This morning on Today's Woman, what your nails can tell you about your health, from texture and color to shape and strength. The structure of your nails can actually be a window into your overall physical condition and possibly an early indicator of serious illness. Well, Dr. Susan Evans is the chief of dermatology at the Skincare Physicians of Beverly Hills and a WebMD skincare expert. Dr. Evans, good morning.
Good morning.
So here's the thing. I mean, I don't think people really realize how much our nails can be an indicator. Are they dependably an indicator?
They can be a window into your overall health, and that's why you should examine your nails and notice if there's any changes going on with them, and in some cases get it checked out.
So basically we're looking at self-examination that will look at asymmetry, border, color, diameter, or whether they've changed, whether they've evolved.
Exactly. Is the nail a normal color? It should be like a flesh color, pinky color. Do you still see the landmarks like the half moon at the base, or are things changing? Is it also widening at the tip of it?
Okay, so let's look at what some of the problems could be. For example, there's something you call clubbing, which I'm not sure what it is, first of all.
Clubbing is when the very tip of the finger actually expands and gets wider and relative to the rest of the finger, so you're actually reminiscent of a club, and it's due to the widening of the finger so that the body can try to get more oxygen
and
to the tips.
And what illness is associated with that?
Well, this is pulmonary problems with getting oxygen, and also congestive heart failure, some other problems getting blood to the tip of the fingers.
There's also something called pitting.
Yes.
What is that?
That is associated with most autoimmune problems. 50% of people with psoriasis actually have this, along with those linear lines, and it means that the nail is not growing at the regular pace, and there's some defects.
So this really means that you've got a psoriasis problem.
It does. It could be other autoimmune problems like alopecia areata, other kind of autoimmune problems.
So something you should go see your doctor about.
You should get it evaluated. There's a possibility that there's something more serious going on.
Now, we've also, you were also talking about white nails, when there's a kind of a slightly white hue to your nails. These are an extreme example. There can be actually some a little bit less than that. But what does that mean?
Absolutely. Well, just a pale nail could be anemia. White nails, 80% of the people that have liver disease actually have that. It could be other problems like hyperthyroidism. It's a workup because there's other things that can cause it, but it should be investigated.
You have a little mannequin, a hand mannequin here to kind of give us another couple of examples. Something, for example, when you have a yellow-green color to your nail, that could indicate what? I think that's on our index.
Yeah, it's sometimes a normal variation, but when it starts being green and thick and crumbling, it could be a fungal infection, which is very common. About 7% of Americans actually get that.
When there is a stripe in the nail, like in this one here, what does that indicate?
Well, it could be a normal variation if you're older, but if it's something new and it's widening greater than 3 millimeters, you should go get it checked out. It could be a skin cancer, melanoma.
If there is, and that melanoma you're talking about would be under the nail, that would be on the nail itself.
Yes.
This little white stripe and a little reddish hue in your nail means what? This
right. Those are like terry nails, which has to do where the nails you would think would be pink and then white at the tip. It's actually the opposite, and it could be associated with renal failure.
Okay, and red and brown linear lines like in this nail here?
Those are splinter hemorrhages, which are sometimes associated with endocarditis, infections of the heart. So if it's associated with a fever and you have these popping up in the tip of your nails, then you should be evaluated for endocarditis.
If you can't grow your nails long and you can't, and they're brittle, they break, should we worry about that?
Sometimes that comes with age. You may need to add extra moisture to your nails, and it could have to do with your diet, and that's when things that you can supplement.
What would you supplement that with?
Well, biotin with B-complex is great. Vitamin E is also wonderful, and iron is another great thing to make sure that it's not a result of anemia.
So bottom line is, if we see something unusual about our nails, we really, when we go into should we make a special appointment to go see our doctor?
Absolutely. If you see a change in your nail, it could be an indication that something serious is going on inside.
And as we all know, early detection is always very, very helpful.
It makes all the difference.
Dr. Susan Evans, thanks so much.
It was my pleasure.
And eat almonds, apparently.
Yeah, it's great. It's always healthy.
All right.